I was seeing everywhere little rainbows. I was on the Quebec side at that point. Little rainbows just drawn on, sometimes on in windows of houses, on schools, and also just our well-known stores. I wondered what it meant, but I just felt good about it. Under this rainbow was written something like "Ça va bien aller," which in English means everything will be fine. In spite of being fuzzy and warm inside, hearing that, because obviously I was very anxious and we could see that people were getting stressed, buying everything that they could in supermarkets. Basically, our lives were changing. In spite of feeling good about what I was hearing and seeing, I felt a discrepancy, profound disconnection. Because the actual life, the new life that was actually starting all over us, didn't quite fit with this slogan, right? Everything will be fine. How could we know at that point? It just had started. Today, I want to talk to you a little bit about the connections between pandemics on one side, the environment, and public health, right? We hear a lot about that in the news, but I want to put emphasis on one dimension that we may hear, we may not hear, but is very much not prevalent in the mainstream media. And also just when we talk to our families and friends. And this dimension is the role played by animal agriculture in this whole crisis. So let's start with the impacts of the pandemic. We know them pretty well. We get sick, people die, people that we know, friends, family, and mostly vulnerable older people or people with an already sensitive immune system. There is a lot of anxiety, lots of pressure on health workers, social workers, and people in the front line. Lots of burnouts. Day in and day out, I read about new articles about how people can't stand that ongoing pressure. Lots of people decide to stop working, which, as a vicious circle, pressures the remaining people even more. What we know also is that there are some hotbeds for pandemics. Those are meat factories, meat industry, and farms. Lots of people working there get sick at a rate way higher than the actual rate of the whole population as a whole. And who gets the most sick? Often people of color. So then we see the dimension of racial inequities coming into account. What we've seen also is that our life has been changed from the beginning to the end. There's been lockdowns, depending on where you live. The transportation is changed. Some can't go to work or are asked not to go to work. So all our economy, and mostly what we don't talk about, our perceived relation to the outside world is crumbling. It is crumbling. Poverty has, as a result, increased. This pandemic has actually provoked even more pressure on the already frail system. What do we see? There's a citation here saying, social distance is a luxury that the homeless can't afford. We might think, how irresponsible of them. But what can they do when you don't have any more options? Some people, as a result of poverty, live many in the same house. They, as a result, they're poor, and another burden that they have to take is that they'll probably get sicker in their communities too. It has been estimated that the poverty level has increased 18% only since the pandemic, which more or less, according to studies, is equal to between 10 to 30 years back in terms of the poverty rate. What does poverty means? Increased health problems, increased mental problems, rupture with society, crime rates, and so on. The social divide and polarization has also increased. People have different views about how the government should act in this crisis. And it is legitimate to question the government. But it's not only a question government between people. People, the actual population, is getting more and more entangled in this, more and more emotional. They can't see the other side. The polls are getting more extreme. We see in US events like this where people are just standing with firearms in their hands. Police violence and racial tension that we all have heard about is impacted by this overall crisis. But let's talk a little bit about now the zoonotic disease. What is that? We don't talk a lot about that. It means a disease that comes from the contact, direct or indirect, with animals. And here we'll learn that the responsibles are not animals. That would be very easy to say. The actual responsibles are us, humans, and our human activity, which is entrenching in the natural life, and the intensity and the actual agriculture being one big notion. But let's understand, how does a disease, how does it work? So it's basically a vicious circle. The human activities, so humans here, this section, we are producing more, taking more from the land, taking more resources, and obviously not thinking of a circular way to use and reuse. We're actually taking, using, and dumping. We're doing the same with the animals that we all use and eat. This puts a stress on the overall environment. For example, for animal agriculture, we need to cut down lots of trees, so deforestation is increased, which in turn increases the loss of biodiversity, as well as brings more pollutant in the soil, in the air we breathe. So climate change and pollution, which in turn affects the farm animals we have in our lives. Actually, we don't have them in our lives. We have them in our plates. So that might be, this is obviously one big problem. When they're in their plates, they're meat, but when they're alive, they're animals. The connection is not there yet. So when we cut down lots of space to grow wheat and food and soy for the animals, like this impact on the environment, makes it more probable that there is going to be contacts between wild animals, which can have diseases, with farmed animals, and on another step, then being in contact with animals because we eat those animals or we work closely with them. So we can see here a little example of this. There's many factors, and this is very important, that has been published by the UN, that are increasing the zoonotic emergences. And this is not nothing. This means we're talking about the cause, right? The cause of this. If we want this pandemic to stop, well, it's too late for that. But if we want to avoid other pandemics to emerge, this is what we need to take into consideration, among other variables. So among all those variables here, you'll see that we address in the media a lot about the illegal and poorly regulated wildlife trade, the wet markets, right? We close them down, at least in theory. But all and also like the taking of wild animals and bringing them in contact with humans, which is a cause of the emergence. But all those four other factors here: deforestation, increased and intense agriculture, climate change, and antimicrobial resistance, those exist independently, but they are all very and intrinsically codependent and linked to our general way of living, which is to eat meat, which is to eat animals, which is to be in close contact with those farm animals, and we'll understand how climate change and all of those are related. Again, another visual for the same thing. They even write directly here the demand of animal protein, and this all the UN and all these other research organizations are behind this graph. We have increased our intake of meat in our daily life, food, 260%. So this means we have more and more chance to be in contact with those emerging and deadly viruses. Not only we are more in contact with them, but the spread will be faster and bigger, and the rate of death as well, if we have another pandemic, are likely to be bigger too. We're not putting the chances on our sides. So let's see here a bit about how transmission can work. So you see this bubble. Transmission can work either from a direct contact from farm animals to humans, from wild animals to farm animals to humans, or only to the wild animal to humans. So this by hunting, for example, is a good example of when they get into contact, those two, for wild and humans, and illegal wild hunting as well. So you see there's many diseases in each one of them. And it's interesting that we haven't heard before the actual pandemic that the animals and our contact with them, which is due to our human activities, such as eating meat, was, even before COVID, was a major cause of diseases and future pandemics. We say that almost 80% of emerging diseases come from animals. So we see here also the impact it has. Like, those numbers seems like numbers, but they are actual humans suffering behind that. Death and cases. Avian flu comes from, it says it in the name, yes, the poultry industry. Ebola, SARS, it comes from bats. MERS, it was from the Middle East. It came from a I don't know the word in English. It's dromadaire. And mad cow disease comes from cows, because we eat the cows, right? Avian flu, again, we said it. And swine flu from, well, it says it in the word again. But it's really complex. It doesn't just happen like this, right? It happens because of how the industry is actually treating animals, confining them. Recently, we had new cases of avian flu in France, and even in Canada, in Alberta again, of cases of swine flu. This just goes to say how the prevalence is high. Another pandemic is not a question of if it will happen, but when it will happen. It's happening right now. Hopefully this won't cause a pandemic. And let's take into consideration what is told to us humans in this time of crisis. Well, we have to take 2 meters distances, wear masks, and so on. Live in isolation, basically, not to see anyone. See, it's very nice, 2 meters, obviously the size of this here. But do we have the same standard for animals? Well, we can look at how it works here. Transportation, living ground. As you can see, the animals are not only tightly crushed together, they don't have lots of space, but this is actually increasing the possibility of a disease emerging. Plus, most of them are very sick. Their mental health is not good, right? They daily they have to they have their tail cuts. For pigs, they have their tail cuts, their teeth cuts, very sensitive, holes in their ears to put tags for cows. They're castrated, often without any anesthesia. So those are not exceptions. Those are how it actually works. I've talked to a few farm animal veterinarian, and they say that this is a real issue. I'll have to plug it in. Sorry. Yes. As we can see, the animals don't have space to actually do what they need to do, what they would do in nature. They are highly intelligent animals. Pigs have the same IQ as a kid of 4 years old, but this is not necessarily this is not the main point here. The main point is that those animals can suffer, right? So the suffering circle is not independent. Those animals suffering in mass in their life, and when they'll go to the killing floor, is actually impacting our own health. In the actual animal industry, are those systematic distances kept to avoid the propagation of the virus? And no, what we see here is that they're very much all crammed together. This left photo shows how, and this is, by the way, this is considered free range. Although the walls are very big, they're pretty much all stuck together, which means if one gets sick, probably all of them will get sick. Same thing in the transportation. The pigs here are grasping for air. You can see a picture here. The pig they're crammed, grasping for air. They don't have water nor food for a long period of time. More than 48 hours, imagine going somewhere for 48 hours without stop, without food, without water, and lots of stress. And stress, we know, weakens the immune system. So their immune system are very weak and very vulnerable to propagate the virus. So the 2 meters distance is not kept between all our farmed animals. Again, here we see an example. On the left side is the wet market here. I mean, obviously that doesn't seem very positive for those animals, but on the 2 other pictures are here. It's here in Canada and America. It seems cleaner, but they're as crammed, and we'll talk a little bit about antibiotics later. Here is a picture of, it seems like a hotel, amazing, beautiful, but it's not. It's actually a pig farm, which is supposed to be less dangerous for future pandemics. Look at that. Those pigs will stay on all those floors, won't move
one floor, they'll stay at the same floor all their life until they die, and then they're put in a garbage bin and they'll just go down. So not one time in their life do they see light. That, I mean, we're, instead of actually stopping the cause, we're trying to control it. It's very discussable how and where this is going. Also, as we said, a little controversy, and even United Nations is not very World Health Organization not very happy about that. They're talking, and there's articles here saying that we should stop using antibiotic on healthy animals to prevent the spread of antibiotic resistant bacteria. Basically, by injecting all the animals eat in their food or are injected with antibiotics, even when they're not sick, which as a counter result makes bacterias resistant. So what it means concretely is once those animals will be eaten by humans, and then therefore that in the humans, we will also be resistant to those bacterias. In other words, when we get sick for a little thing, usually we get antibiotics. Well, those ones don't work anymore, and that's a major problem. You can be sick and die from a very mild and soft virus. So it is estimated, for example, to give you just a proportion, that 80%, so most of our antibiotic is fed to the animals in Canada. Same thing for USA. It's not given to humans, which also creates a problem that humans have problem accessing them more, but it basically makes us more vulnerable to get sick and die from very basic things. So the concept of health, usually we see it as a very personal thing. My health, it depends on how I work out, it depends on what I eat, right? It's true. But more and more scientists and medical experts are understanding that health doesn't only depend on your own actions individually, it also depends on other factors, namely how we treat globally our environment and how animals are being treated and used. Those all come into one health, which is not very far-fetched, right? Because those domains, health, animals, are only separated in our minds because it's easier to understand and to be expert in one or the other, but the reality is that they're all interconnected. So in order to be healthy as a human, we have to take into consideration steps to allow our environment to thrive and to allow animals to be basically liberated and more free and happy. So here we can see James Hansen was part of the people who created this, which is a new way of understanding our economics, which is a bun economic. It's very nice. It's like, so for creative people, you may see this side, and for more down to earth, you may see this. Basically, what they're doing with that is that they're taking the 9 limits that we shall not overcome in order to pursue all human activities on Earth. Those boundaries, there are 9 of them, they're all on the side. If we're in red, it's not a good sign. It means we're going over the actual boundaries, our limit. We're going over limit. Now we see we're going over limit in 4 distinct places: climate change, nitrogen and pollutants and phosphor pollution, land use, and the loss of our biodiversity, which is to say plants and wild animals. 4 out of 9. This means we are in a major crisis. On the other hand, not only are we using too much resources in the wrong way, but our basic needs, which is supposed to be represented in the middle of this bunch,